we're here to talk about one of the most difficult concepts to discuss, which is the immersion concept, which is highly debated. And so I've been working on a chapter for a textbook on role-playing games and role-playing theory, and I was tasked to write a chapter on immersion, which is a very debated concept. So I kind of came up with a theoretical framework that I think encompasses some of the major concepts, certainly not all. And then Anne and I have connected them to healthcare. So
we didn't get to change the format because we've been too busy organizing conference.
Yes. Immersion as a metaphor is often compared to water. It's akin to being submerged in water, submerged in another reality. It takes over our whole attention. It implies active engagement and agency, and the term flow is often used to describe this state, which is another water metaphor. It's being immersed in a task similar to a water current carrying a person along a course. This is a 6-category model. The first one is immersion into activity, and that's where this flow state, I think, is really useful. So repetitive execution of a particular task or activity. So it involves a certain degree of agency because you're actually performing something that is meaningful and that you have some sort of choice about. And it's often equated with positive affect or quote-unquote happiness, which is providing a sense of achievement, lowering anxiety, and improving self-esteem.
So those of us in nursing are familiar with the oldest form of simulation, which is task trainers. So we've got here a pelvic exam task trainer, an IV arm task trainer, and here this is a virtual IV task trainer. So these two on the left are the more traditional form of simulation where you're practicing a certain task over and over again. Our first semester students practice that insertion of an IV about 100 times on a rubber arm before they ever do it on a human being. And there's some more advanced students practicing their pelvic exams. This one, the virtual IV arm, is a little more elaborate because they have to choose which cannula is the most appropriate for this patient, which vein is going to be the best considering some certain patient conditions. If your patient had a right mastectomy, you can't do an IV in the right arm. So you have to choose that. And then it's got that, as you can see, haptic feedback device. They have to insert the IV just right. And if they don't do it right, the computer tells them, no, you didn't get the IV. And so our senior students do this IV program so that they can learn how to get a really good IV.
So a lot of these immersion states overlap, and so here, what she's describing, you have to do some tactical thinking, which leads us into our second category, which is immersion into game. You have to kind of decide, using strategic thinking, how to solve the problem. It's often called adopting a illusory attitude in game theory, which means a willingness to strive towards a game goal using its rules. And we talked a little bit about that earlier in the keynote. There are lots of different people who've written about this. I'm just going to kind of go through them very briefly. But the main concept here is that there's this tension between frustration and triumph when you're playing a game. And that can also carry over into simulation. And this is different from the immersion into activity in that you are using more complex problem solving. You're using more abstract reasoning and strategic thinking. This is called, in role-play theory, often called gamism.
So I liken this to the virtual patient simulators. So this one is, or these three are screenshots from a few different virtual patient simulators. You talk to the patient and they give you vital signs and you choose which nursing action you're going to do. It's got a definite action. Sometimes it can feel really boring to students because it's a little bit railroaded. You have to choose this action or there's no real flexibility in it. But it can be very useful to teach a specific sort of case that can really only be solved in a specific sort of way. I'd say it's pretty useful for your junior level students that are trying to figure out how to do things.
And so moving forward with the idea of this being a game, we can try to maybe make more options and give them a little bit more agency in these simulations.
Oh, there you go.
Okay, so the next one is immersion into environment, which is a lot of what Keira was talking about. Creating a physical reality that is very realistic, like we have upstairs. So this is exploring the different aspects of an alternate game world, whether physical, mental, or virtual. So the environment can be online, or it can be in physical space, or it can be imagined. So I can imagine a very realistic environment if I have the right tool set. This connects with presence theory, which is multifaceted and covers multiple categories. But the idea is the more realistic the setting becomes, the more immersion players will experience. And so that's the principle behind building a lab like this, is that if we make it look as much like a hospital or a clinical setting as possible, then they will be immersed. And then there's also telepresence, which we were talking about earlier, which is being immersed in a world through the computer. Or projecting oneself to an alternate location, such as remote surgery, which is very, very interesting. So the idea is that you're attempting to render the visual environment accurately, e.g. high fidelity simulations, which Anne has written a lot about with regard to edu-larp. Historical reenactment societies, where you have these people that are trying to pretend to be in Vietnam or whatnot, and everything has to be perfect in the visual environment. 3D online worlds, and as was mentioned earlier, 360 degrees immersion LARPs, where everything is trying to be perfect. And this is also called what you see is what you get. So that you don't have to have that cognitive dissonance of, what is that really here? Sort of thing. And this is often called simulationism in role-play theory, although that word means many things to many people. Oh, Mark?
Oh, yeah.
So there's the problem with this concept is that there's this immersive fallacy that some people have put forward. That is, there's this assumption that increased production values will lead to greater immersion, which is not always the case. And Johanna Koljonen, who was here, it's very exciting, had a similar critique of 300-degree immersion in LARP, saying that a complete environment alone does not generate better role-playing. But it can help ease the transition from the mundane frame to the game reality. So it's much easier to buy in when it looks similar, right?
So we've got a few different, we got a few different simulators here. This one is Noelle, that you may have heard about if you had the simulation lab tour. This is a mannequin that gives birth, and there's the little baby that they just delivered from Noelle. So this helps students practice birthing, and here, if they're taking care of a sick infant, there's another baby that I can't remember what it's called. Chris, do you remember?
Sim baby.
Yeah, this is Sim Baby, or maybe Sim Newbie. Is being intubated and having a lot of really complex interventions done in sort of a neonatal intensive care unit type simulation. And in this one, a nursing student is applying oxygen on a Sim man, and this is the sort of way that we help nursing students interact with the patients. So the patients can be programmed, these robotic patients can be programmed to simulate a variety of conditions: cardiac arrest, anaphylaxis, even so much as just an infected limb. You know, we can use makeup, mixing different things. Dr. Covington is quite a genius at mixing infected wound smells.
He has a cookbook.
Yeah,
Yes.
yeah. There's a cookbook that can make all sorts of disgusting infected wound smells and colors, and so that students can come in and they can know what it smells like when a wound has been infected with Staph aureus, for example. And as you can see in these pictures, and as you've seen upstairs, sim labs are often structured to look very much like a hospital. This is something we have in our sim lab where you can watch the students interact with the patient, but you don't necessarily have to be directly involved. We've got a couple of those rooms in our nursing school. And we've also got rooms with cameras so that we can watch the students without breaking their immersion in their environment as nurses in this simulated hospital.
Cool. So 3 more categories, bear with us. Immersion into narrative. A stirring narrative can, quote unquote, obliterate the world around us, as Janet Murray says. And this ties into transportation theory, this idea that a narrative will transport a person to another time and place, and that it can be very persuasive. So whenever we watch a movie and we kind of get absorbed in the film, that's this narrative transportation. The first-person audience of role-playing, though, as opposed to watching a film, means that you are both the audience and the participant. It makes role-playing games more personal and more intense because the players both enact the narrative and observe it. I'm going to go real fast through it. This is called oftentimes narrativism in role-playing theory. So in nursing, we've got unfolding simulation. So a patient will start out with a condition that seems relatively mild, and then as time passes, things get more and more severe. I love this picture because it really shows the drama of what it can be. You can see an episode of ER and see nurses and doctors and respiratory therapists rushing around to do all those things, but when you're the person that's giving compressions, when someone else is trying to intubate and you're yelling at them, do you have the defibrillator ready? That feels much more dramatic. The simulation, we do this for the seniors every year. They get to be part of a cardiac code team, and they love it because they get to be a part of the story, a part of the drama. And there's a narrative arc that's unfolding.
Right. There's a narrative arc. You know, he starts. We have a patient. You know, we have one male, one female. They start, and their condition worsens and worsens and worsens until they get into cardiac arrest. We have family members that come in. What's going on? Why are you pounding on his chest? And we have one case where the patient lives and one case where the patient dies. And they have to deal with it. They have to talk to the family members. They have to explain what's going on. Yes, your husband lived, but he's going to be in ICU for a while because all his ribs are broken from doing chest compressions on him. Or, we did everything that we could, but your sister died. I'm so sorry. And that's the part of getting students to realize, no, this is real. This could actually happen to you. Okay. Another thing is the standardized patients. And standardized patients help really get the students involved into this simulation. I did standardized patients for the first time in my class, and we had students filing into the sim lab, thought it was a regular old day, and then they looked over and saw a person sitting in bed wearing a hospital gown, and they said, "What's going on? There's a person in the sim lab." So it really helps them understand and respect and see simulation as real patient care, to have a standardized patient.
And real people have stories.
Yes, they do.
I'm going to briefly talk about immersion to character. We feel that this is one of the most underused aspects in simulation, which is creating a character that the person embodies. Oftentimes they're just playing themselves, or playing themselves as a thin role of you as a nurse someday. So giving them more narrative is interesting. And so that experience of enacting a character and being in it is often called immersionism. But the idea of reacting in the moment as that person. It creates this double consciousness where you're both yourself and your role at the same time, which can be very instructive from a learning potential. And then there's a lot more theory. But the most important thing here is that it can produce catharsis. And we talked about bleed earlier. Bleed is this transfer of emotions and thoughts and feelings back and forth from the player to the character. And those kinds of emotional reactions oftentimes can be very instructive later.
So we've got certain things that we do to try to help students get into the character. This one's an obesity simulation. The student is wearing a weighted suit to actually feel what it's like to be very obese. And the nursing students that are caring for her are also experiencing that, taking care of a patient who is obese. This one is a geriatric simulation. She's wearing a suit to simulate the reduced range of motion of arthritis. She's wearing goggles to simulate low vision. This is a poverty simulation. We do this at Texas State. where students have a very limited number of resources and they have certain things that they have to get. They have to pay their bills, they have to buy groceries, they have to pay their rent, and they don't have enough resources to do it. So they have to do a lot of wheeling, dealing, a lot of maneuvering around. There may even be, they may have to pawn stuff at a pawn shop, and stuff like that. This last one is the hearing voices simulation. You can't see it too well, but this gentleman is listening through earbuds on an MP3 player, and it's playing voices that are whispering in his ear. These voices were developed by people that had schizophrenia to replicate the experience of hearing voices as someone with schizophrenia.
So the last one is probably the most important one, but we don't have time to talk about it, unfortunately. Immersion into community. These experiences are communal. You were talking about these teams that are having these experiences together. We often forget that there's a social component both in and out of character. So I'll just go through that really quickly, but essentially it helps create fellowship, leadership, and teamwork. And there's a group flow state that you can get into together that can be really exciting. So do you want to just briefly?
So we're kind of touching on this in simulation with interprofessional simulations, with simulations where we designate one student as the leader of the group. And some clinical groups are going to work really well together. Some clinical groups have personality conflicts. But that's one of the things that we're really working on, I think, is in the cutting edge of simulation in nursing, at least, is trying to encourage teamwork and encourage identity both as a nurse and as a member of the healthcare team.
That's it. And then we have lots of resources.